Hi, I'm Erin Caballera here to present case 30 out of the T. Zane Reeves book, Ethics in HR, the Unsinkable Molly Brown. The particular Molly Brown that we're talking about in this case is a nurse supervisor at a large public health hospital on the Navajo Nation land in the Four Corners area of the States, specifically at Fort Defiance, Arizona. One night, Molly was on a ward and an orderly came to pick up a patient for surgery. Molly found this odd as there were not any orders nor signed consent for this surgery in the patient's chart. She sent the orderly away empty-handed, only to have him return a few minutes later saying the surgeons were adamant that he bring the patient to the operating room for his circumcision. Molly got very suspect at this time because this particular patient was a 98-year-old man who was admitted the previous day for falling and fainting in a store nearby, not for a circumcision. Also, she knew there was a surgical consultant in-house that was consulting and teaching surgeons for or about more rare surgical procedures. Certainly she figured this particular patient might be used as a guinea pig for an adult circumcision. She sent the orderly away again, only to have the surgeons return a few minutes later and fairly aggressively try to remove the patient to take the patient to surgery. In the moment, Molly acted very courageously, standing in the doorway and informing the surgeons if they wanted to take the patient to surgery, they would have to roll her over with the gurney. Following that particular incident and understanding that the patient or the hospital had had some history of this type of physician behavior before, Molly wanted to report those physicians to hospital administration as well as potentially the medical society for them to be held accountable, perhaps severely admonished, maybe even have their license taken away, though she figured that last part wouldn't happen. However, the more she thought about it, she was very concerned that reputation for that sort of behavior or controversy about this incident outside the hospital might discourage a very distrustful population surrounding the hospital, already leery of seeking medical care, from coming to the hospital for fear something like this might happen to them. For that reason, she decided to follow up personally and privately, having a conversation with each surgeon and letting them know what the consequences could have been, and just admonishing them herself. Each one sheepishly agreed that it wouldn't happen again, and that was the end of that. Ethically, Molly did the absolute right thing, courageously in the moment, protecting that patient. However, her follow-up, she seemed to lose that ethical momentum. In not reporting more officially up through administration and to the medical society, not only were those physicians not held accountable, but she put herself in harm's way for not reporting something that's very serious. Should somebody report that, it could be her who's held accountable for not reporting the behavior in the first place. Further, her concerns about patients not coming to the hospital for fear that this might happen and wanting to protect those patients, in allowing this behavior to continue, it might actually happen to these patients when they come in, which is the furthest thing from what she wanted. Therefore, I think when we consider ethics in HR, we need to make sure that we carry through all the way. Now, Molly did the difficult thing in the moment. However, carrying it through to the end, to the accountability portion and the part that might be most painful, she failed to accomplish.